Hey guys, it's Terry Darnell. I'm going to be talking about the project I did in Nurse 456, my senior practicum on ICU delirium. ICU delirium is defined by an acute change in mental status, inattention, and cognitive disturbances. It has a higher mortality rate of 2 years after discharge, and an even higher mortality rate if they have 5 or more days of delirium. Early detection for delirium is crucial, such as being the most common tool called the CAM ICU. Symptoms include, but are not limited to, hyperactivity, agitation, restlessness, and anxiety. You should assess pain, both spontaneous breathing and awakening trials, choice of agitation, delirium assessment, early mobilization, and family engagement. This is also known as the ABCDEF care bundle. I noticed that the medical ICU had a lot of delirium on the unit. Once I started investigating further, I noticed that the nurses were not assessing for delirium and then not treating it properly. My goal was to educate the nurses on the importance of assessing, preventing, and treating delirium properly. I started my project by assessing the knowledge of the nurses on the unit. I watched how they interacted with the patients and how they charted. I noticed that a lot of them were skipping over the CAM ICU portion. I got a total of 10 peer-reviewed articles on ICU delirium and made a handout booklet to give out during a huddle on the unit. That included nurses and physicians. I created a handout booklet that I handed out during a huddle on the unit that at least 50% of the staff attended, and also sent out an email to the others. I then distributed a quiz to the staff based on the booklet, with all but one person getting all questions correct. All articles were ICU delirium related, ranging from how to assess delirium using the CAM ICU tool and the ABCDEF bundle, how to treat non-pharmacologically and pharmacologically. I then talked to the unit director about mandatory education on HealthStream related to ICU delirium. I found a couple that helped with this project and showed them to her. Here I've provided my favorite article that I resourced a lot throughout my project. It goes into detail what ICU delirium is, what the mortality rate is, and how to assess and treat. I also added the booklet that was made and handed out to the staff members who attended the huddle, along with a quiz that was handed out afterwards. You are more than welcome to click on them and see what they are. My main outcome for the unit was to help educate staff on what delirium was, how to assess, prevent, and treat it. Some of the more experienced nurses knew what it was, but were too inclined on their ways they did not want to learn. Some of the new graduate nurses were unaware of what ICU delirium was and how to assess. They were the ones more interested in learning. By the end of my project, I spent a week observing the staff like I did the first week of the project. I noticed a significant difference on how the staff were responding to the patients experiencing delirium. The 10 peer-reviewed articles gave me a better insight on how much ICU delirium is mistreated and overlooked. Using the articles to create a booklet and quiz helped educate the staff on the unit on the importance of assessing and treating delirium. I assessed the staff for a week after all education has been applied and noticed a difference in patient care. The value of this project requires me to take ownership of my learning and take initiative to complete projects. It also creates powerful learning experiences, which helps create a powerful learning experience, both academic achievement and personal growth. It also has a meaningful collaboration as I discovered ways to work within a group. It instills interpersonal values and skills.